Mr. Cohen, could you give us specifics about your plan to address the growing healthcare crisis? And do you think there is any other country that has a healthcare system that we might follow or emulate?
As I said in my remarks, Elaine, I am a candidate who, for many years, and specifically in this campaign, have been calling for a single-payer, publicly funded, universal health care system. This is a plan that is ready now to be implemented. I don't believe that we need to do this state by state or try to encourage states or, yes, I believe all kids should be covered immediately. I'm for that. I think Al is one of the people, everybody here probably, is for covering all of the kids immediately. But we have countries such as Canada and other Western nations that have single-payer, publicly funded systems. This is a system where the government simply is the payer, not the delivery of these services. You can go to private doctors and you will have a system that has reduced the administrative costs by over 30%, between 30 and 37%. And I believe essentially that the way to accomplish this is, one, extend Medicare for all. That is a system which can work for all of our citizens, adults and children, reduce the costs, allow for private funding, allow for competition, and get the HMOs and the massive stock options and bonuses that are given to those gentlemen that head those companies, get that out of our system, because it no longer is serving the average American woman and man. And I'll say this finally. If we're talking about a healthcare system that works and single payer can work, then we've got to start to implement it now. I know there are a lot of critics of single payer, but I say turn those mass of critics into a critical mass. That's what your senator is about. Leadership, statesmanship, being bold, speaking out, educating the public, and getting the momentum behind a system that we know works in many other countries in the industrialized world and Western world.
Let me just say again, I've been going around the state holding listening sessions. I bet I've had 100 or 200 meaningful conversations with Minnesotans, and they're all talking about health care. They all have horror stories to tell, personal ones. This is a system that is really, really broken. In fact, I heard someone the other day say, we can't even call it a health care system. It's not about health. It doesn't seem like anybody cares. It's not organized well enough to be called a system. I would say that's a pretty good definition of what we've got and why we need alternatives. Now let's just start by saying that Canada, Britain, France, Germany, they all have different approaches to how they do this, but they all do it well. And we can learn a lot from them. So there are different models that we can pursue. But I do believe that we as candidates need to be upfront and tell you that the system is broken and that it can't be fixed without meaningful, deep reforms. So I also am an advocate of a single-payer healthcare system in one form or another. I think otherwise we end up with piecemeal approaches that don't work. And again, my frustration is the starting point for most of what we're hearing is defending those powerful corporate interests. We have to take those interests on. Now, one other thing that I would like to say that hasn't been said, and that is our medical system needs to focus on prevention and health and not wait so long. I mean, we have 47 million people who use the healthcare system. They get access to it, but it's way too late. It's very costly for the country, for the people involved. So, yes, there are ways of moving forward. By the way, a recent poll says 69% of U.S. people want a single-payer system, and they'll pay more taxes to get it. And the truth is we can actually save money, cover everyone, provide medical coverage, mental health coverage, all if we fight for the meaningful reforms.
Thank you.
Medicare is going to go from 367 billion fiscal 07 to 482 billion fiscal 2012. We have a single-payer system. It is Medicare. Minnesota's exporting hundreds of millions of dollars a year because states with greater votes rule the roost. That's how the reimbursement goes. So here's what I think we need. We have to go to preventive health care. 75 cents out of every dollar is spent treating diseases that are preventable at the outset. We're treating them at the back end in the most expensive place, the hospital, usually the emergency room. Universal access, same policy, essential benefits. I don't care who you go to, you get the same identical policy, covers pre-existing diseases, and it's portable. So that if somebody loses a job, or they want to transfer a job to a better job, and they have a disease, but they can't take the job because they have a pre-existing disease and they won't get it today, cover it, okay? Transparency, so you know what you're getting. Information technology. If you do those things, and then you go after the drug companies, which I said. And I said this back in 2000. Number one, reinstitute the law that prevents drug companies from directly advertising the public. That was in effect up until 1997. And when they took that away, today, 1 out of every $7 of pharmaceutical company revenues are for promotion. Enforce the patent laws. The drug companies today are using the patent laws to extend their patent monopolies and enforce those. There's things we can do. And let the government negotiate with the drug industry. There's a lot of things we can do and get on preventive health care, and we can have a health care discussion. Because still today, we talk about all the other countries, but today still, the majority of the most creative, innovative health care is coming out of the United States of America. So it's not a completely broken system, but it does need to be drastically revised. Now, if you want Medicare, go to the doctors who are now saying, we won't even take Medicare patients because they're capping what we're going to get paid.
Well, we do have some good health care here, some very good health care, and the greatest health care here in the state. We have a terrible system. We spend 16% of our GDP on health care. No other industrialized country spends more than 11%. We only cover 84% of our people. They cover 100%. We have to go to universal health care. I want to go to, I don't think we can go to single payer right away because I don't think it'll pass. But I think what we need to do is tell every state you're going to go to universal care, and you do it the way you want, but mandate that every kid is covered in a single payer program. And then they'll be able to compare that single payer system for kids with the way kids how it worked before. And I think that everyone will want to go to single payer. This is how it worked in Canada. First Saskatchewan did it, and after Saskatchewan did it, it worked so well that Diefenbaker, a conservative, adopted single payer for Canada. I'd like to tell a quick story. I've been talking to people about health care too, all over the state. Someone from right here from Golden Valley is a friend of mine who works at the Hampton County Medical Clinic, Margie Hope. I asked her what happens when, she works with working poor kids, what happens when parents earn just enough money so the kid loses health care, loses their Minnesota care. She says it's devastating. She told me a story of a girl, 17-year-old, brilliant girl, does college level work in high school. She has lupus. Lupus can be treated though with the right medicine. Parents earn enough money to be over the threshold, she loses her health care. She tells her parents, don't buy my medicine. You can't afford it, you have other kids to take care of. They know she's right, they don't buy it. 6 weeks later, she's back in Hennepin County with, this time in the emergency room, and she has to have dialysis because she has renal failure. And what's more, she may have to have dialysis for the rest of her life. This isn't just wrong, it's stupid. How much is this going to cost her to have dialysis every week for the rest of her life? How much is it going to cost her in quality of life? How much is it going to cost in what we're going to get out of this brilliant girl's society? We've got to get to universal, and I want to go to single payer for every kid in this country. I think we started with
But I'll take another 3 minutes.